The following program was produced by an independent community producer. The opinions expressed do not necessarily reflect those of the ECAT staff or board of directors.
Giving a voice to the voiceless, pulling stories out of the shadows and putting them under the spotlight, making sure that each person is valued and cared for. This is Humanity First with Peter Evers, presented by BAMSI.
Hi, everybody, and welcome to another edition of Humanity First. My name is Peter Evers, and I have the privilege of being the CEO here at BAMSI. For people who have listened to this before, this is a show about some of the services that we deliver, but we sometimes broaden that conversation to what is going on in terms of the social mores of society and what is happening in government and how does that affect vulnerable populations, the people that we serve. Today is no exception. We're actually going to talk about the Trump administration's new approach to provision of healthcare services, specifically those people who struggle with addiction, but also with HIV and AIDS, and some of those monies that are given to the likes of BAMSI to treat those people, to meet them where they are on the streets in a harm reduction manner, that is, helping them as they're using drugs with a view to, attain recovery. So really looking at how are some of the changes that the Trump administration have put into play are affecting people on the streets and how they will. And also addressing this notion of the work that we do is evidence-based through healthcare experts and researchers. And much of what the administration is doing is the sort of penalizing and criminalizing of the poor and those people with diseases. And so who better to talk about that than our VP of Healthcare, Behavioral Health and Community Services, Jess Almeida. She's been on the program a couple of times, and she oversees our harm reduction programs, our trans programs, and our HIV and AIDS programs. So we're going to get into it. We're going to see what the situation is now, what hope there is for the future, in some ways that organizations are combating some of these new regulations that, I'm going to say that they're pretty clever and kind of interesting. So we'll be right back. Stick around.
Hi, I'm Jamie. I'm an essential worker here at BAMSI, and I'm a nurse. Nurses are essential here at BAMSI because as nurses, we really have the opportunity to make an impact. We have very small ratios, so we have the opportunity to really learn everything about the person served and be able to give the best care. It really serves such a great purpose for me as being a nurse and really why I came into nursing. Learn more about nursing opportunities at bamsijobs.org.
Giving a voice to the voiceless, pulling stories out of the shadows and putting them under the spotlight, making sure that each person is valued and cared for. This is Humanity First with Peter Evers, presented by BAMSI.
Yep. Hi, everybody, and welcome back to Humanity First. As I promised at the top of the show, we have a guest who is not a stranger to conversations on podcasts about harm reduction. Jess Almeida was with us, our VP in Behavioral Health and Community Services. Welcome, Jessica.
Thank you for having me.
Good. This is an interesting time in America, both politically and health-wise. And obviously, we're going to talk about health because we do a podcast about humanity. And oftentimes, we talk about vulnerable populations on this show. And it seems to me when we have a change in government, or we have a change in the economy, and this one, I believe, is sort of man-made, if you like, the first people to suffer in these circumstances are those who don't have very much. Yeah. And I think that's where we're at now. And when we think about those who don't have very much socioeconomically, we also think about folks who struggle with diseases and are often described on the fringes of society. Let's just begin by talking a bit about BAMSI's harm reduction services and where we provide those services and what we do.
Sure. So we have two harm reduction programs at BAMSI, one in the city of Brockton and one in the town of Plymouth. And they're two very different communities, so we operate a little bit differently in both. But what we do is we provide, as you said, harm reduction services. So that includes syringe services. It includes HIV, Hep C, STI testing. It includes access to treatment for folks. We're able to connect folks to treatment. And along with that is also offering other materials, life-saving materials, from clothing to safer injection or smoking equipment, condoms, basically anything that will help somebody stay safe, stay disease-free, stay alive, and also connect them to treatment.
Yeah, somebody once said to me when we were doing a Narcan training, and so just so folks know, Narcan is a overdose reversal method that we also
exactly, and that's another big part of what we do with these programs too.
Yeah, and somebody said to me when I was working in a detox, a dead person doesn't recover, right? And that's really the essence of harm reduction when we talk about it. And just before we get into the changes that we're facing at the moment, what's all this based on? Is this an evidence-based practice? Medically, are we looking at something that has proved to work?
Absolutely. Harm reduction is an evidence-based practice that's been around for a long time. And I mean, if you think about it, everyone practices harm reduction in some way. Look at those GLP-1s. Mm-hmm. That's a form of harm reduction, in my opinion. It's helping people to lose weight and be healthier. And some people may say, well, people shouldn't do that. They should just do it the other way, the real way, or, you don't know what these medications will do down the road. But it's helping a lot of people. And so I think if people can think about it that way, instead of just, you're just, making people continue to use drugs. Well, they're going to continue to use drugs if we're there or not. Yeah. But having syringe services programs and harm reduction programs in communities has other effects. It helps people get the help that they need. If we weren't there, it's still legal to give out syringes. Anybody can buy syringes and give them out. Right. But we're there to provide all of these other services, including also collecting syringes from people in the community who may have diabetic syringes, the GLP-1 medications, as well as, on-street outreach and educating our individuals that we serve to not dispose of needles incorrectly and to bring them back to us, as well as we're there for the community, for them to bring us syringes too. So if we weren't there, I feel like we would still have the problems that sometimes pop up with discarded syringes.
What's really interesting to me is that we have RFK in DC sort of making lots of decisions about how we go forward. And the reason I asked you about harm reduction is, as an evidence-based practice, medicine is actually based on best practices, right? Emerging best practices, proven best practices. I often think about, penicillin as an evidence-based practice, antibiotics. Yeah. They have gone through the FDA. They've been looked at as, are there really, can we really show that people get better from using this? It's a fundamental practice of medicine, right? Yeah. It's a little odd, don't you think, that we have somebody who isn't a physician, who has quite a history of various run-ins, medically, legally, etc., who's making some decisions about medically proven interventions. What, our folks are on the street every day. And it's interesting that there's a new piece of legislation called Streets, which is really saying, leaning more towards, I would say, criminalizing poverty, criminalizing disease. Why does that have traction with some people, do you think?
I think it's a lot of optics. I think it's out of sight, out of mind. I don't think people like looking at people who are, I don't like it either. It's sleeping on the streets or, gathering and having encampments, and people don't want to see that. So I feel like a lot of it is optics, and maybe that's a way they feel like they just want to get the people off of the streets.
To where?
Honestly, I don't know. I guess what they're saying is they want to get people into treatment. Right. But to me, that's forced treatment. Yeah. And we know forced treatment, that's been studied as well, and that doesn't work. Yeah. I was reading an article the other day, I think it was through WBUR, and it was about what's happening in Boston. and the new, systems, the processes that they're working. They're basically telling people, you can stay in this corner and you're going to be arrested, or you can go to treatment. So that's not a big choice for people.
Well, actually, what's happening with that is, right, people go and then check out exactly the next
That's
day.
exactly what I was going to say. Yeah. They talked to two individuals and I took the cab and they dropped me off and I went back.
Because we're not addressing the underlying
exactly.
addiction, but we're also not addressing the underlying fundamental disparities in health in this country, right? But I don't see that as part of the public health initiative.
No, I don't either. And we have a housing crisis in this country. Yeah. There's not enough housing. There's not enough treatment beds. There's not enough access to medicated assisted treatment. Although that's improved over the past several years, it needs to be, on demand. It needs to be when people are ready.
Yeah. All of this seems to be, the other thing they're talking about is this AOT, this outpatient treatment that is enforced, if you like, which is very much similar to the Section 35 that we have in this state, but we don't have that on the mental health side. If we move to that, I can see why people say, I'm going to challenge both of us to think about this. Well, look, we've been trying these things for years and years, and still we have people under the bridges. And we've talked about underlying causes that we haven't addressed. Janet Reno was actually the last politician to suggest that we had a health policy that covered America. And, I remember it, but I'm one of the few people that probably does. Maybe it's because it's something different that we're in a society now that sort of approves of the punitive intervention, more incarceration, the identifying people who are poor as aberrant, if you like, to the American way, to the way in which people live. How do you address that when people go, well, look, we may as well try something else?
Yeah, I mean, I don't have an answer, but I think it's starting with those individuals and maybe asking them what they need to get off the streets. What do you think you need to get here? Kind of like motivational interviewing. Doing, I think, more of that, just treating them like human beings, I think is a big part of it. Because I don't feel like they're looked at oftentimes as human beings. They're looked at as a nuisance. I mean, these are the people's children, moms, dads, aunts, uncles, grandparents. I mean, they're suffering and they're struggling.
A very prominent person, I'm not going to name that person in this podcast, when I was talking to that person this last week, said something like, look, people have choices. People left home. They made that choice to leave home. They should just go back home. And I was just astonished at I mean, if you begin to think superficially about that, then you sort of give yourself permission to say that, right? Yeah. Because there's so much beneath that.
Yeah, and I don't think a lot of these folks have choices.
Right.
Maybe at one point in their life, they made the wrong choice or several wrong choices. And by circumstance, they ended up where they are. But now they don't have a lot of choices. They can't just walk into somewhere. They may have burnt bridges. They may have, acted, wrongly to somebody. And so I don't agree with that. I don't feel like they have a lot of choices, unfortunately.
I don't think you're right. And I think your point is that humanizing this whole thing, you need, I've certainly worked with people who struggle with substance use for a great part of my life. And I have some of the most hope that I've ever felt from people are when they have decided that they need to make a change in their lives. Yeah. And they talk to you about, nobody at 6 or 7 years old say, I want to be in a ditch with a needle in my arm, right?
Or be unhoused and sleep under a bridge.
Right. Nobody. And no parent wants that of their kids. And I think sort of thinking that way. But let's just move on here to an interesting case in Washington, in Lewis County in Washington that you shared with me. Really interesting case about how maybe as providers we can sort of fight back against some of this legislation and some of these grants that are coming along which really aren't in line with what we believe. Let's talk a little bit about Washington.
Yeah, so I read an article, and it was, like you said, Lewis County in Washington State, and there was a church group, and their mission was to help basically provide harm reduction services to people using drugs in that community. And the county passed an ordinance which barred them from providing services, or really changed the way. I think I'm not exactly sure if they had to go to 1-to-1 or what it was, but they fought under the ADA.
It's the Americans with Disability Act.
Thank you. And they fought, and it probably took them a while and probably had to spend a lot of money, but they won. And they won under the ADA to where individuals who are using drugs are allowed
access to healthcare.
Yes, allowed access to healthcare, and that's in looking at harm reduction as healthcare.
Yeah.
So I'm hoping it sets a precedent.
Yeah, it's a brilliant move, and Lewis
Yes.
County actually paid $500,000 worth of court cases and
That's
reversed
right.
their decision. So there is hope out there, I think, for people who follow evidence-based practices and understand the disease of addiction in the context of the human being, and I was pleased about that. Let's just pivot a minute to the criminal piece of this. You know, one of the things that the Trump administration is touting, and they often find something to say this is cause and effect. And one of the things they're saying is that the closing of the borders has stopped more drugs coming into the country, and claiming that as a reduction in overdoses.
Yeah.
I know you feel a little differently about the reason for that.
Yeah, I feel like the reduction in overdoses over the past couple years that we've seen go down, and I want to draw attention to it was still 80,000 individuals who died. Right. That's still a big number. Yeah. Those are 80,000 human beings that are not alive anymore. Right. Someone's loved one. Yeah. But I really feel like over the past several years, there's been money put into harm reduction programs to allow us and other programs across the country to get Narcan into people's hands and to provide other harm reduction services, as well as treatment. They've increased access to medicated assisted treatment, treatment beds. I think that is more of the reason why the overdose rates are going down. And I'm afraid that with the attack on harm reduction, that we may see those go up, along with the HIV rate and hepatitis C rate, right, and probably a lot of other things.
Well, yeah, especially in giving information about vaccines that isn't that is ill-advised, let's say.
Right, and so we're seeing the measles outbreaks happen.
Yeah. I think it is a time when we feel a little bit under siege, and maybe we should talk about this, but we have a grant from SAMHSA, well, you tell the story because you guys were on the receiving end of that. But I'll start the story. I woke up early one morning a couple of weeks ago to find an email that came to me at 3:00 in the morning telling me that our substance abuse mental health services had withdrawn our grant for HIV and AIDS prevention services, and it was as of today.
Yes, terminated. No notice.
No notice, whatever. How did that feel?
Yeah, I was on vacation in Florida, and I was reading my emails, and I saw that, and I'm like, what?
Jessica's never actually really on vacation, by the way.
My first initial thought was, oh my gosh, did we miss a report? Did I do something to make this happen? And then I read more, and then I actually saw a post on social media that this was across the board. Yeah. And I was like, I was just floored. And then I'm, emailing you all back home going, okay, what do we do?
Yeah, because you've got to think about our staff. How
Exactly.
do we do that?
Yeah. Do I just tell the staff you don't have a job today? Wow.
One of the things that people always say is, and I just want to send out props to the Department of Public Health here, because they don't get enough credit for really standing behind the work that we've done and this understanding. Well, they are the Department of Public Health.
Yes.
That these interventions are actually efficacious to people, more so than chronic diseases like diabetes, for instance. We have better outcomes, and it always needs to be said. And that's the CDC that's saying that. But tell me the denouement of this story, because by 3:00 in the afternoon that same day.
Yes, then we got a notice that it was either that same day or the next morning or the same day that it was reversed. And I think that was due to a lot of advocacy. I think NAMI was a big advocate on that, because these grants were also around mental illness.
That's right. That's the National Association the Alliance for Mental Illness.
Yes, sorry. I'm used to using all these acronyms. Yeah, so they did a lot of advocacy, I think, and I think people just pushed back and then they just reversed it and they were like, oh, psych, it's back.
Felt a little bit like an abusive parent in some ways.
Yeah.
That's sort of like, we can do this to you, but
yes, and I think that's a reflection. There's so much chaos.
Yeah.
Like you don't know from what day to next, and prior to that, we had to change our language on our website and our objectives for the grant. We had to take out certain language, can't use certain language. We can still do the work, but we can't use the language.
Jessica, there's going to be a lot of people listening to this perhaps who think, well, so what? So what? This is a small part of the population that are incorrigible, that we can't help. At least this government's doing something about it. And, I want to get on with my life. I just want to go back to a couple of things you said at the beginning. And it is the humanity of this. Mm-hmm. One life is too many, right? And an injustice to somebody is injustice to all of us. And that's what this country is built on. This is why I wanted to come here from another country. And I think it's a country that is new and it's a country that's finding its way, but it always has had the generosity of spirit, in my opinion, to care for those who are not as well off as we are.
And I feel like there's been a shift in that.
Yeah, I do too. And my hope is that we'll get that back.
I hope so.
Yeah.
I hope so.
Jessica, thank you so much for coming in. There are many other conversations that we're going to have in the future. I don't think this is the end of funding threats and things like that. But we will work with our state representatives and we will do all that we can with the resources that we have to continue to provide this service. BAMSI was one of those organizations that stepped up right at the beginning of HIV and AIDS and said, nobody else wants to do this, we'll do this. And that's basically what this organization is all about, just stepping in when others are unwilling or unable to do so.
Yeah.
So thank you so much.
Thanks for having me.
Appreciate it. Thanks. Bye, everybody. See you next week.